As a GYN oncologist, you have to start out as an obstetrician gynecologist before you become a cancer specialist for that. I grew up on a farm and helped my dad and uncles deliver a lot of cattle and things like that. So I actually thought I wanted to be a veterinarian. And I came to UT to go to vet school. And then once I got here, I was still interested in reproductive health, and so I switched. I met some pre-med students and switched to medicine. I went to undergrad at the University of Tennessee, and medical school was in Memphis, state school, for all my education there. And then after medical school, there's residency and fellowship, and that's 7 years. And the sort of the premier program at the time was, and probably still is, one of the best, is at UAB. So I had to swallow my Tennessee pride and go live in Birmingham for 7 years and train there in cancer surgery. East Tennessee is a special place, and so my family roots are in East Tennessee, and of course the university's here, and the mountains and the rivers, and the good old Scots-Irish people and all the people in East Tennessee. So that was an attraction. I think the size of the Cancer Institute is very attractive. It's not too big, and it's not too small. And that size allows all of the cancer doctors here and nurses and mid-levels to basically be together almost in one room when we do conferences. The expertise is here, so I know personally what's here, and so I would have my surgery here, or my cancer treated here, or I would have my wife's or family members' cancer treated here, because I know all the expertise is here. So I like the female patient, and I like the reproductive stuff, but I like surgery a lot. And so then I learned that there was a subspecialty called GYN oncology, which was perfect for me because it was female patients, reproductive health. There were lots of what appeared to be underserved cancer patients with cervix cancer, uterine cancer, and ovary cancer, which is what I did. When I came here, I was the only GYN oncologist among the other cancer doctors. And so that ability to step next door, walk down the hall, and talk to your colleagues about difficult cases or new clinical trials or research or opportunities is really unique for the UT Medical Center here in Knoxville. And that's, I think, should be attractive to patients. We all trained at all of the big places around the country. So, you know, my colleagues here are UAB trained, they're Mayo trained, they're MD Anderson trained, they're Duke trained, Vanderbilt trained, any of the so-called named big academic medical centers. There are a lot of patients in East Tennessee that cannot travel elsewhere. So we are, and should be, the Mayo Clinic, if you will, or the MD Anderson of East Tennessee. And that's what I think we have to offer for the patients that are here. They don't have to go anywhere else, because these are cancer patients. They're matriarchs. You know, they're the center of the family. Mothers, grandmothers, aunts, sisters, daughters, so vital to the livelihood of their families back home. And I want them to leave confident and in control. I want them to leave knowing they have the power to have understanding of their cancer, and then what we're going to do, what we recommend for them. And so then if they're on the team, then we start out in a good place. But I think seeing them quickly, getting things scheduled quickly, getting them educated quickly is a real strength of the Cancer Institute here at UT Medical Center. I grew up in a family of musicians, and so the music is sort of the center part of our family activities. And so I have 3 children, all play musical instruments or sing, and my wife plays the piano when I can get her to do it. And then my dad was a fiddler, and my mother played the guitar, and so our family time always involves music. We don't turn on the television, you know, we turn on the CD player or now the iPhone or something fancy to play music. The close relationship, personal relationship that we have with our patients, we know them by name, by first name, that kind of care and warmth that is throughout East Tennessee. Right? It's not an impersonal place, and the medical center here at UT is the same. It reflects the culture in the region.